You do too much and you flare yourself up. You do too little and you're not happy with where you're at, and you avoid things and you freak yourself out and train yourself that movement is bad. It seems like it's a lose-lose scenario. If you have some type of back, butt, hip, or sciatica problem, chances are you have the itch on the good days, the good weeks when you think you figured it all out to get back to activities you love. But how do you do so in a way that's safe, that improves your confidence? My name is Dr. Charlie Johnson. I'm a physical therapist. I have my board specialty in orthopedics, and I've reviewed over 10,000 of these cases of people like you all around the world. And I want to share with you a proven process or framework so you can get back to doing things while not hurting yourself. All right, so you have all these activities you want to get back to, but where do you begin? Where do you start? How do you not hurt yourself? Step one, you've got to write a list. You've got to have some direction that you're trying to head in. You've got to have some destination, otherwise it's hard to buy the plane ticket. So you've got to list out all the activities, and by the way, write the list. Try not to box yourself in. So many times people are in pain, and let's just say that you're a runner watching this. And I say, hey, well, write all the things you want to get back to. And then running's not on the list. I'm like, well, why isn't running on the list? And they're like, well, I would love to get back to that, but I'd be okay if I never ran again. Maybe you say, I'd be okay if I never deadlifted again. I'd be okay if I never did this again. That's how you start to box yourself in and impose self-limiting restrictions on yourself. And that comes from a place of fear and or scarcity that you're going to hurt yourself and set yourself back, which is fair, but it also starts to really limit the life that you live and often the quality of life that you live. All right, so list things out. This should be like a Christmas list. This should be like a wish list, a bucket list. Just write everything out. Try not to judge yourself on it. Write everything you truly want. Second thing is, within that list, I need you to segment it into the things that feel more safe, versus less safe. So let's just say you wrote 10 things. Some things are going to be more safe. Driving 10 minutes down the road is probably going to be more safe than taking a 10-hour plane trip. Doing the dishes might be more safe as a starting point than starting to run a marathon. Take the list, divide it in half. More safe, less safe, or more threatening. Then I need you to pick one. Pick one of those things on the safe side of the list. One of those little categories. Hiking, walking, jumping. Maybe running's too threatening. So maybe it starts with walking, something like that. Going to the gym, whatever it may be, just pick one. And the reason I say pick one is because a big fatal flaw that I see is that as people start to feel better, they start to do all sorts of things. They dabble a little bit in swimming, and then they go for a walk, and then they do some spring cleaning, and they wash the car, and they do all this stuff. And then they're like, hey, I'm worse. And I'm like, well, that stinks, because I don't know what made you worse now, because you started to dabble in all types of things. So let's pick one, because God forbid this system fails, quote unquote, on us, which really means it just gives us feedback. Then we know, because we've gotten that feedback and because we've remained systematic and scientific in our approach to getting back to living life, we know what happened, and we know the activity in question. We don't have to question it. So pick one activity you want to get back to on the safe side of that list. Then within that one activity, there's going to be a spectrum, if you will, of, well, Charlie, okay, I just picked running that I want to get back to, or let's just say walking. Let's just say walking to make it maybe a little bit easier to start for a lot of folks. So Charlie, I picked that I want to get back to my walks. Awesome. Well, within walking, you could walk 20 miles, you could walk 0.1 miles. There's a gap. You could walk uphill, you could walk up the side of a mountain, or you could just walk on level surfaces. And so now what I want you to do is I want you to paint a picture of what it would be like to get back to that thing. And imagine that I knocked on your door. Here's a single question that is going to help you filter down to where to begin in a way that is safe, non-threatening, and very unlikely to flare you up. Insert whatever activity you want to get back to. Maybe it's walking. I'll use it for this example. It could be lifting weights. It could be, again, swimming, biking, hiking, doing some work outside, gardening, whatever. Let's just say I knocked on your door and I said, Mr. or Mrs. So-and-so, whoever you are watching this video, I heard you want to get back to, insert your activity, walking. Are you ready? Would you be okay if we went for a 2-hour walk? A 2-hour walk. Something happened. Psychologically, something in your brain, when I said we're going to walk for 2 hours, would have happened. Either your brain said, oh, heck no, or heck yes, or maybe in the middle. And so insert any duration, insert any distance, insert any amount of weight if you want to get back to the gym. Hey, I heard you want to get back to lifting weights. Do you think that if you want to get back to lifting weights, maybe squatting you want to get back to, we could lift 200 pounds? 200 pounds. Maybe it's too threatening. And now reverse engineer that and keep asking yourself that question till you get to a point where you say, you know what? I think I could do that. Measure twice, cut once. You can always start small and go from there. It's harder if you start doing too much and you set yourself back. That'll really demoralize things. You won't believe in the process. All right, so maybe you can't walk for 2 hours, but if I said, knock, knock, can we go on a 1-hour walk? Knock, knock, 20-minute walk? Maybe. Knock, knock, 2-minute walk? 2 minutes. I could do more than 2 minutes, but let's start with 2 minutes. Maybe it's 5 minutes. So the point is that ask yourself that question, reverse engineer, such that that really gives you an insight as to the fears, the worries, the narrative, the belief system, the story that you have around that activity which you're trying to get back to. It tells you what your current level of safety and or threat is, with that thing psychologically. How do I know it's psychological at this point? You haven't actually done it yet. So now you're kind of at a spot where you got the one thing, you know where you're going to start. But what about when you're actually physically doing it? How do you know if you are risking setback flare-up? So there's a couple things. Red light, yellow light, green light. This is an analogy that I would recommend that you use, such that when you're doing something, you have another layer of protection there. Red light, yellow light, green light. Stoplight. Red, yellow, green. When you're doing an activity, ask yourself, is this a red light activity? Is it putting me in the red zone? Is it putting me in the yellow zone? Or is it putting me in the green zone? Green zone, by the way, is like no pain, no problems. You probably wouldn't be here. So we're going to talk about red and yellow. By the way, red light activities. You want to not do these. You want to say, hey, that's too much, too fast, and I'm risking a setback. Psychologically, if I participate in activity, and I'll define it here in a second, which is within that red light zone, I am likely freaking myself out, setting off the bells and whistles, reinforcing the pain that I'm experiencing, and or physically, I'm causing some type of damage to the tissues in my body. So what is a red light activity? What could be defined as that? A red light activity is one whereby it puts you in severe and or sort of extreme experience of symptoms. So on a scale of 0 to 10, let's use a pain scale. And now I say that we're not going to do 0 to 10. We're going to do a 0 to 100 scale. 0 is nothing, 100 is the worst ever. Let's blow up the problem. Let's make this more clear. 0 is no symptoms. 10, 20, 30 is low. 40, 50, 60 is medium, moderate, tolerable. 70, 80, 90, that's severe. A red light activity is one whereby when you're doing it, if you ask yourself the question, is this low pain, low symptoms, moderate, or severe? You start to say, this is severe, 70, 80, 90. It's too much too fast. You've got to avoid it. You've got to stop it. You cannot participate in that thing, unfortunately, or you've got to get really creative, start to think outside the box that you can do it, but it's not red light if we want to classify it. Also, activities which put you in this red light zone are not only pretty severe, so again, maybe that 60 to 70 out of 100 on that 0 to 100 scale, but they're also really sensitive, highly irritable, meaning you do something, and then after you stop doing that activity, you're all flared up. You're all annoyed. You're all hot and bothered. You can't find comfort. Maybe you can't sleep at night. You're reaching for a muscle relaxant, a pain pill, something like that to calm things down. That is a red light activity. We can't do that. So we've got to stop these, if at all possible. Or if not feasible or possible, we've got to tweak them, modify them, such that we can bring them into this yellow light zone. Now, this yellow light zone is where you want to live. A lot of times people try to wrest away their pain. They try to avoid it. So if they avoid something, well, it's green light. Of course, because they're not doing it. They don't experience any pain or symptoms because they're just avoiding. But that which you avoid, or the more you avoid it, you reinforce as something that's dangerous. And while you're avoiding it, you're not exposing your body to it, which means you're becoming more and more deconditioned. So when we've gotten to this point in this funnel where we're narrowing things down that we want to get back to in the way we want to get back to them, a yellow light activity is one by you experience some symptoms. Now, these symptoms should be tolerable. If they're not tolerable, they're in red light, and we've got to find a different way to do it, or we've got to stop it. So are symptoms low, medium, or high when you're doing the activity that you've chosen to get back to? If they're tolerable, and if they're, say, 10 to 60, that's probably a sweet spot. Maybe 60 is a little high, but you make the call. So it should be moderate in severity. And then sensitivity-wise, things that fall in the yellow light zone, which I'm actually okay and recommending that you do participate in to help you get over your fears, help you face your fears, reduce your anxieties, worries, concerns, your belief system around movement, and also to help you physically become more conditioned to start to stress and strain your tissues such that they can adapt and become stronger and more resilient long term. Oftentimes when you're participating in an activity which is in this sweet spot, this yellow light zone, the more you do it, the better it gets. Or the more you do it, it just kind of stays the same. In which case, it tells me you're not inflaming something further, because the more you do it, it's not getting worse. It's just staying the same. So yellow light activity, moderate severity, totally tolerable. The more you do it, it either stays the same and or it gets better. And when you stop that activity, symptoms simmer down pretty quickly. Maybe a few minutes, 5, 10, 15 minutes max, something like that. You return to your baseline, which tells me it's not doing any lasting damage or harm. Again, mentally or physically. Yellow light activity. You're not having trouble sleeping that night. You're not reaching for pain pills, things like that. You do it. You feel symptoms. You remove it. How did I do? What comes from that? A message of safety. I'm okay. I did that thing, I felt it, but you know what? I'm not damaged, I'm not broken. I did that thing, and the more I did it, the better I felt. More confidence, more motion, less fear, more motion. You're getting back to living life because life is motion. Green light, no pain, no problem. Yellow light, that's where you want to live. Red light, stop, tweak it. Graded exposure. A little bit of a tip here. When you get back to any activity, try not to get back to it full blast. If this is a highway, don't be one of those people who makes a merge ramp like that. Give yourself a little bit of a leeway. Stretch out the runway, so to speak. Most people get back to activity, they do this. This is what it looks like to get back to it. Very steep stair step. So the walking example. I used to walk 2 hours, Charlie. 2 minutes is pathetic. Well, it might be pathetic, or so that's the story you tell yourself right now. So what do? You get emotionally involved with that. It seems really pathetic. So instead of making objective decisions and looking at this logically, you say 2 minutes. Oh, that's nothing. I did 2 minutes. I'm fine. So then the next day or later that afternoon, you go to 4. And the next day you go to 8. And before you know it, in a 5-day period, you're from 2 to whatever the math is, 20 minutes. That's a tenfold in a week. Imagine we're talking about lifting weights. You're lifting the 60s. You're feeling really strong. And then the next day you decide to lift 120, and the next day you decide to lift 240. Those are big jumps. 2 to 4 is double the volume. It might not seem like much, but it's double the volume. Be careful doing too much too fast. Increase the on-ramp, the runway, the time that you have to merge. If you like the stair step example, stretch out the stairs. They're easier to walk up. You can get acclimated to this. Do 2 minutes, 2 minutes, 2 minutes, then go to 3, 3, 3, then go to 5, 5, 5, then go. And look, you won't have to do this for forever. You'll start to build more confidence. The more confident you are, the more you move. The more you move, the better you feel. And you'll start to make an exponential return to that in most cases. Measure twice, cut once. Start small. You can always do more later. The last thing I want you to do is try to go up a stair step like this and then fall back down again. And we've kind of got to start over. So graded exposure. Now the final thing, we'll talk about kind of prevention and or a little bit of a way that you can actually check prophylactively, meaning beforehand, to make sure you don't get to a point of no return. If you have a motion which you have known to be painful in the past, or currently a motion or thing which is a little bit yucky, not necessarily this activity, but let's just say that you know that you went to PT and bending backwards is a little bit painful, or pulling your knee to your chest is a little bit problematic. Do it. I want you to do it right now. Do 1 rep of it, just 1 time. And I want you to get an idea for what that feels like. And almost like you could use a heart rate monitor or a pulse ox to check your like respiratory rate and oxygen saturation, things like that in your blood. Or almost like a doctor might check your blood pressure repeatedly as you're doing a stress test or something like that. We can do the same thing with the movement system to make sure that we're physically and psychologically, but primarily physically at this point, okay. So we can use movement like a blood pressure cuff to make sure that something bad doesn't happen before it actually happens. Do the motion. Do a motion which is somewhat provoking of your symptoms before you do an activity you want to get back to. So let's just say that you're going for this walk. That's you walking. Do your motion right here. Get an idea for how yucky it is, how problematic, how restricted it is. Then go for your walk. But maybe you don't go for the full walk yet, because sometimes then it's too late. You did too much too fast, and now you're like, I wish I could go back in time and not do that. But what if you knew that you were setting yourself up for a setback? Go for a walk. Maybe you have in your brain plan to go for a 10-minute walk. Stop at 3 minutes. Do your test again. What happened? Check your blood pressure again. Check your movement system. Check your movement quality again. Go for another 3 minutes. Now you're at 6 minutes. So you're walking. Check your yucky motion again, 1 more time. What happens to that motion quality? Does it become more stiff, more restricted, more painful? If so, it's telling you, hey, your movement system is getting a little bit yucky. And the more you do it, it's getting yuckier and yuckier. And if you're not careful, and how do you not check this? You might be setting yourself up for a flare-up setback. And so use movement, not only as medicine, but a little bit of like a check on your pulse, a check on your blood pressure, so to speak, a check on the quality of your movement system to see how it's tolerating the motion that you want to get back to. Let's just say that instead of walking, maybe it's like your work shift. Do the motion at the beginning of the shift. Every half an hour, gently check to see what's happening with that thing that you started with that motion. Is it getting more stiff? Is it getting more painful? It gives you then a notice, a little bit of an alarm or a warning system to say, whoop, 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 movement quality is deteriorating. You need to do something. And it can stop you before things get to that point of no return. So there we have it. Apply just a couple of these things. You can apply the whole darn thing if you want. Or maybe you think it's too much to go about applying this process to getting back to life. And if so, that's fine. But if you don't follow a framework, then chances are you're going to be lost. And you're going to be trying to get back to things randomly without a system for knowing, how do I know if something's making me worse? Where should I start so that I feel most safe? And God forbid something flares up, well, what was it? And so I'd hate for you to go down that path. Hopefully this is helpful. Let me know your thoughts in the comments. And if you're interested in learning more tips or tricks, I've created a ton of different videos to help people all around the world with back, butt, sciatica problems, because this is what I love and this is what I do. Thanks so much for watching. Appreciate it.